In this video, we're going to talk about the basic timeline that if you have matched into a prelim general surgery position and you want to go on to become a categorical PGY2 or a PGY1, what should you do and what is the timeline? First of all, score curriculum. This is a website. Access mostly the programs will give it to you. It has an access of 4,000 plus MCQs. It has a weekly quiz also that many programs require you to do and do well on them because it helps you train for the ABSITE. So first you have to do these weekly quizzes as your program directs you to do, and then there are about 4,000 plus MCQs that you can do. Now I would recommend that you have a routine where you do like every 2-3 days a week rather than utilizing all your weekends and your days off in doing these MCQs, because as a PGY1 you will have 4 days off a month and it may not be realistic that you will utilize all of them studying. So I would say rather than that, have a plan that you're going to do 10 or 20 MCQs 2 or 3 times a week and have a schedule. So that is for the MCQs. The other website you need to know about matching is the APDS website. You just Google open surgery spots. It will show you, click on the link, it will show you all the programs in the country that are looking for a PGY2 prelim. Then when you click on them, it tells you the requirements. Usually they want your case log, your letter recommendations, your ABSITE scores. Now that's why your ABSITE score is very, very important. The most important thing for matching into a PGY2 prelim is the ABSITE score, and that's why the score curriculum helps. The other thing you can do to improve your ABSITE score is TrueLearn. It's another website with 2,000 questions, and you can utilize that as well as a resource. In terms of reading for ABSITE, I would suggest that there are some podcasts you can utilize. There are some websites you can go to. YouTube has a lot of educational videos you can utilize. And if you're going to use a surgical textbook, I recommend just sticking to one surgical textbook and going from cover to cover so that you have covered all the topics and you know what you know and what is missed so that you can read later on. Now I can go on to the timeline. So basically the ABSITE is in January. Remember, once you become a PGY1 prelim, you are going to sit for the next match in 3-4 months, because July starts and then September is in 3-4 months time. So the letters would be roughly the same. You would have to get a letter from your new chair or your program director, and then make sure you are able to get those letters on time, and then you apply for the match. The programs will give you time off for your interviews. Now, one thing to remember, that if you don't match into a PGY1 categorical, that is also the other thing that you need to score very well in the ABSITE, because either you can get into a PGY2 categorical somewhere or a PGY2 prelim. And then the other thing is, if the program that you're working in likes you, then again the ABSITE plays a very important role for making sure you match into that program. Why is ABSITE score so important for them is because it tells them you're going to pass your American Board of Surgery exams, and that's the key. So my advice is study for your ABSITE, and number 2 would be keep looking for open spots, and number 3, keep in touch with your program director and your attendings who are going to be working with you, and ensure that they know that your goal is to become a PGY2 categorical or match into a PGY1 general surgery position. Best of luck and thank you.